Okay, in Chapter 15, we're going to talk about data collection and interviewing individuals and groups. So let's go ahead and get started. So when we're looking at interviews, they may be structured or semi-structured, and it's almost always based on the investigators' created interview guidelines. So when we're examining the structured interviews themselves, usually they are very organized and they're super structured, and it closely kind of replicates a questionnaire, an examiner asking deliberate questions with deliberate answers. There's a set of specific questions and possibly a set of possible responses and a script, because it's very confined. The thing about the structured interviews, it doesn't allow for different perspectives, it being so structured that it kind of fits things into categories, so to speak, so it doesn't open the discussion up for ideas or insights or those types of things. So there's a certain purpose for using those very structured interviews, and they're much more concrete than the semi-structured interviews. So that's when we're looking at really open-ended questions and having open responses, and really getting those responses that are very unique and does offer that type of insight that sometimes, especially with, of course, qualitative research, that is so valuable, because we're looking at that human perspective and that big picture and experiences when we're looking at gaining a broader view versus just very numerical or structured or categorical information. So one thing is to pilot the questions, and that's really important when we're devising studies, to really test those questions out to see how folks react to them, because again, as I've spoken about in previous PowerPoints, that we have our own perspectives and we may see something very differently than someone else does, and we may word a question in a very different way that maybe someone may not truly understand. So this really helps to refine the questions and to make sure that you're actually getting the answers to the questions that you want to ask. Sometimes the questions may trigger something totally different than what your aim for your research may be, and that's the same that holds true when you're critiquing as well. Are the questions appropriate for the aims of the study? So those are things to key into. So very often the questions are reviewed by experts and reviewed with peers, and then piloted with a group of participants, similar to the population of target. So that way the participants can really respond and see how that interaction actually occurs. So with a specific, going back to the structured interviews, they are scripted questions and there's no deviation from the wording. And two, when one trains those who are assisting with research, it's important to train them to deliver questions with a certain tone and a certain consistency, so it doesn't kind of skew maybe how someone may perceive, because we can ask questions in different ways and use different intonations and emphasis that may lead folks to answer in a certain way, and that's something that we do not want to do, because we want to have as objective of an answer as possible. So again, the questions need to be presented in a certain order, and using the appropriate prompts or probes that were pre-constructed for the structured interview. So when conducting a semi-structured interview, things are expanded a little bit, but they're still very consistent. And again, going back to training the folks that may be administering the questions, they need to read the questions in the same way and use the same types of prompts, whatever prompts they were instructed to use, and refrain from interacting or inferring their own opinions as there's a discussion during the questioning process. So with those unstructured interviews, again, the training is very important because the person asking the questions, really needs to, it's late. Sorry, everyone. The person who is doing the interviewing needs to be very clear as far as the purpose, and the flow is really important, as the conversation needs to come from the interviewee, not the interviewer. So again, looking at the process, it's important to have that consistency, that the maximum amount of knowledge or information or data is gained without inferring any type of content from the person who is posing the questions. So very often the unstructured interviews are recorded, and sometimes they're transcribed, and then from that transcription or from the recordings, then that's where the researcher can pull themes or whatever structure that they've designed as far as the analysis of the content. And that's, again, something that's very critical, that the structure of the analysis needs to be very systematic, and there are set structures and coding that can be done with qualitative analysis that helps refine how the analysis is completed. It's not allowing the investigator just to read things and decide from their perception what everything means. There are systematic ways to structurally code and develop themes from the data or the information gathered from the interviews. So focus groups are really important, and I know a couple of you are in population health. So focus groups are very often used when we're dealing with populations in a community to gain that very valuable insight, what is really important to them and what is very meaningful as far as interventions, because in the community needs to be the driver of what happens versus us coming in as a provider and telling them what needs to be fixed. So that's very complex, and that's another thing for population health. But really having that interaction between the group and getting the feedback from the group to gain their experiences, to gain their perspectives, is invaluable. And this holds true for groups of patients and within facilities as well, or families within facilities, because they can provide insight that maybe as providers who work every day in healthcare may not even see. And again, that helps with the quality improvement process. It helps with safety, all those components that are critical in making sure that we elevate the outcomes for those that we serve. So when looking at focus groups, it's important to have the focus group in a place that is convenient and also a safe place. And sometimes we bring people in for focus groups that may be in an area that may be perceived as an area of power, like sitting along a table where the head of the table is the person who's asking questions. Again, that infers the the power is with the person at the head of the table. So again, all of those environmental factors are important, and that's something to key into when you're reading about research as well, because really with focus group, it's about the focus group, and they are the leaders of the information versus the person asking the questions. So kind of keep that in mind as well. Really, the person who's asking the questions is the facilitator of gaining the knowledge, and it's important to keep the facilitator keeps folks on topic and encourages explanations and kind of expounding on their thoughts to get that deeper understanding. And once again, it's important to record sessions, whether take notes or actually recording, but all of that has to be included, of course, in the informed consent as to how the study is being completed and if they consent to be being recorded. And finally, analyzing the results. So I alluded to this a little earlier, but it's critical to really encapsulate what was gained from the interview process, from the data gathering process. And quotes do illustrate particular themes, and one can quantify where appropriate as different themes are included. It may be that 5 out of 6 people said the same type of thing. So that's a quantifiable component of an interview. If there were 5 people that basically said the same thing or had the same type of response to a question. So again, it's important to look at the environment and also describe the context of the group and their interactions, especially with focus groups. And sometimes there are different dynamics within focus groups where there may be some dominance going on, and again, that's something to include as the results are analyzed. So let me know if you have any questions about this material, but we're really getting into the nitty-gritty of doing the research, and also in knowing how research is done, that helps you to read through articles and critically analyze what's going on in those articles as well, knowing how it should be done, and then looking for maybe gaps as you're reading some articles that maybe the best possible procedures or processes may or may not have been entailed in a particular research study. So thank you so much. Take care now.